Right now in America, we're in the middle of this humongous pandemic, and we have an opportunity to kind of approach getting back to normal because we have the development of vaccines. And although we have a really great history, I think, of getting people vaccinated and eliminating some diseases of the past, people are very nervous about getting the COVID vaccine. There's a huge context behind why getting the COVID vaccine makes people feel nervous. Some of it is because although I said we have a great history with developing and administering vaccines in the past, we also have a very sordid history in the United States of medical racism.
There are large parts of our communities that have reasons, really important reasons, to not immediately feel trust in processes that is related to the distribution of medical care. And I'll say, as a primary care doctor, that hurts me a lot because I came into medicine because I want to develop relationships with patients and together to make plans of how people can stay healthy. And so trust is really at the foundation of my relationships, and trust is at the foundation of my work in providing care to my patients.
Medical mistrust goes back centuries. And when we think about racism and when we think about the misuse and abuse of Black and brown bodies when it comes to medical research, I think those fears alone is what sits with individuals and why they are so hesitant. I personally was hesitant. I was extremely nervous of the vaccine. I spoke to other Black and brown, whether they were political officials, whether they were in the public health realm, scientists, medical experts, and I became more and more comfortable when I said I'm getting this vaccine, and that was really powerful. And I think that it moved mountains even within my own family, who are still very hesitant, but I think we're making some strides because ultimately we all need to get vaccinated, and that's really what I'm pushing on, is that we need to do the research, we need to trust the science, and we need to understand that the symptoms and the risk of the vaccine is not going to be even close to what you experienced through having COVID.
So if you're worried about what this has done to your community, COVID has been terrible for us. This is an opportunity for us to protect each other. Vaccines don't work if everybody doesn't get, or most everybody doesn't get vaccinated. And I want to encourage people to understand that while there are definitely proof and historical reasons why people would feel unsafe, it's not enough not to explore your own reasons about why you might want to get the vaccine.
This vaccine offers an opportunity for us to stop that turbocharging of injustice. We have got to get past this pandemic. We have got to get rid of this virus so that we can get to the work of addressing those structural issues. It is fundamentally an issue of racial justice.
When we think about justice, when we think about inequity, and we think about fairness, we want to give everybody equal opportunities, not just for things to be fair, but for people to have quality of life. So we need to do a really good job as medical professionals, making sure that we are working with groups of people that are already in the community and making it safe for people to be able to access the vaccine, which means that we're going to where they are. We're in spaces where they can easily go.
We have to think about how we bring the vaccine into communities who don't have the access. And so, just over the weekend, the My Brother's Keeper partnered with the Tufts Medical School and folks from the Cambridge Health Alliance to bring 112 vaccines to the community. What people often said when I walked around that room was, I'm happy that they brought it into the community because I didn't want to have to drive, miles and miles away to get the vaccine. I don't drive. I don't even own a car. I don't know how I would get to these different places. And that's important. It's important that our community is showing up for each other. It's important that our community is saying, we have you, we got you.
So this vaccine is an opportunity for us to overcome inequity. It's an opportunity for us to make things more fair, more just, more loving for all of us if we all can get an opportunity to get the vaccine and not go back to normal. Because I think we learned a lot about how normal was not that great for us, but go back to a place where things are better for all of us.